My name's Tom. I'm a dental surgeon here at Oaklands Dental Surgery. I've been practicing dentistry for over 20 years now and placing implants for just over 7 years at this practice. Just recently finished my full arch dental implant training, providing sort of bigger cases and implants for people who have lost all of their teeth. For some patients, getting a dental implant is just a matter of improving the appearance. For other patients, it could be a matter of function.
Having spoken to my friend who previously had an implant and said how much better it was, that's the reason why I decided on an implant. Every stage was clearly explained, and any questions I had, he answered very relaxed. Didn't worry about anything, if I'm honest. Highly professional, very relaxed, and 5-star, I've got to say. It's been brilliant.
A missing tooth doesn't have to be permanent. If you do lose a tooth, it's ideal to look into placing an implant as soon as possible. The longer we leave things before actually placing an implant, the more tricky it can become. So we always advise people, if they have had a broken tooth, they know that they're about to lose a tooth, come and visit us, have a conversation, let us speak about the implant options that are available to you, and that way we can stage the treatment properly. We even have sedation that's available if patients are really particularly nervous or they're undergoing a large procedure. So we have a lot of patients who have been previously wearing either partial or full dentures who have then transitioned onto dental implant work. Those cases are often some of the most rewarding for us as dentists. Some of our patients are particularly happy just to take their denture out for the last time, being able to throw it in the bin and never having to worry about wearing it again. So if you're somebody who's struggling currently with full denture or partial denture, considering having all on 4 implants, come and visit us today.